Welcome, everyone. Good afternoon, and welcome to What's in a Name, Defining and Discussing Diverse Peer Roles. I'm Gail Cormier, the Project Director of NASTAC, the Family Center of Excellence. I would like to give a warm welcome to our partners today, Shannon Roberts and Lori Johnson-Wade from the Peer Recovery Center of Excellence. They'll introduce themselves in a little bit when they speak. Today's presentation is particularly meaningful to both our centers and to all family and adult peers in the workforce. How many times have we had to explain what the differences between the two roles were? Anyone? I'm always explaining. So today, we're going to try to answer those questions and come up with an explanation that we could all use. Before we start our presentation today, I would like to go over a few housekeeping items. Today's webinar is being recorded. The recording, along with the PowerPoint presentation, slides, and any additional resources will be uploaded on our events page after the presentation. All attendees will be muted for the presentations portion of today's webinar. However, we still look forward to hearing your questions, and we are happy to help you with any technical issues. To ask a question or request technical assistance, please send a message in the chat box, and we'll be watching the chat during the entire presentation. If time allows, we'll unmute, and you will have the opportunity to ask questions. You can use the raise your hand button. When you leave this webinar, now this is very important, you will be redirected to complete a short feedback survey using the link provided. This survey will help us continuously improve our webinars, and it also fulfills our SAMHSA funding obligation to provide them with important data required by our contract. Please note, all information will be confidential and will respect your privacy. We do not offer CEU credits for our webinars, but you will receive a certificate of attendance immediately after you fill out the survey. So when you leave this Zoom meeting, you will be taken right into a survey. You will fill out the survey, and the minute you complete it, you'll be taken in for your certification form, your certificate. I would like to thank SAMHSA for allowing us to share this information with you today. And again, thank you for joining us. It's now time to begin this important discussion and for the presenters to introduce themselves as they begin their piece. I'm so excited.
Hi, thanks so much, everyone. It's so great to be here. My name is Shannon Roberts. I'm a program manager with the Peer Recovery Center of Excellence, and I'm going to throw it over to some of our other presenters to let them introduce themselves, Lachelle and Lori, before I jump into the learning objectives and some polling questions that we have.
Hello, everyone. I'm Lachelle Freeman, and I am the program manager for the National Family Support Technical Assistance Center. Happy to be here with you today.
Hello, everyone. My name is Lori Johnson-Wade. I am a steering committee member with the Peer Recovery Center of Excellence. I'm also a woman in recovery since 1991, and I'll share my contact information with you in the chat. Thank you.
Thanks, Lori and Lachelle. All right, folks. So before we get started with some polling questions, I just wanted to go over our learning objectives for today. Gail kind of introduced them, but we're going to have a conversation today, really carving out the difference between a peer recovery specialist and a family peer specialist role. Walking away from this, you'll understand when there is a need for either or both roles, and equipped to understand which, like Gail said, we're both TA centers, so helping to understand which center you might go to if you're seeking technical assistance. All right, so we have 3 polling questions, and we're going to use Mentimeter. So you can either do this in another screen or another web browser on your computer, or if you pull up your cell phone, you can do it that way too. If you go to www.menti.com, it'll ask you for a code, and that code is listed on our slides here. It is 68215115, and that'll get you into like our hosting platform and the questions here in a minute. I'm going to go to this first question, and I'll give everyone plenty of time to get logged in. And again, that website and those numbers are there up on the top of the slide. And so our first question, and your answers and responses will populate the slide as you answer. Nice. So how familiar are you with a peer role? I like that more people are familiar than unfamiliar. When I first started in this field a couple years ago, I was very unfamiliar. So it's exciting to see that more folks are understanding and learning. All right, so going to the next question. All right, so again, you shouldn't have to re-log in, but if you do, that info's up top. And our next question is, do family peer specialists and peer recovery specialists serve the same role? And again, just allowing time for folks to log in and get answered. Seems like most folks feel the same way, either unsure or sometimes they do. Okay, I like that most folks answered sometimes, because I think that's why we're here today, to have a conversation about what that really means and what that really looks like. All right, last polling question. Again, if you have to re-log in, that info's up at the top of the slide. Can a family peer specialist and peer recovery specialist do the same work? And again, I'll allow some time for folks to answer and respond. Okay, a little more all over the place than our last few, but it seems like consensus is sometimes. All right. Okay, well, thanks for participating, folks. Like I said, these responses are good, because this is why we're here. We're gonna have some experts talk to us about what these roles really mean and how they serve, and the similarities and differences. And if you give me just a second, we, leading this conversation, have created a little animated short. And so I'm going to pull that up on a different screen. And we'll watch just a quick video here.
Welcome to the Peer and Family Peer Support Collaboration, a partnership of the Peer Recovery Center of Excellence and the National Family Support Technical Assistance Center. We're here to understand the workforce, that includes peer recovery specialists and family peer specialists. We will clarify the roles of each, how they are similar, and how they are different. We want to champion a specific and unique need for each role in the field. Let's learn about these two centers of excellence, funded by the Substance Abuse and Mental Health Services Administration. The National Family Support Technical Assistance Center is led by the National Federation of Families, a family-run organization. The center's approach is anchored by the underlying principle that families play a vital role in supporting their children and are the experts regarding their family support needs.
The National Family Support Technical Assistance Center serves families whose children of any age experience mental health and/or substance use challenges across the lifespan, and the workforce, organizations and communities that support families, by providing resources, technical assistance and training. The center is committed to ensuring the technical assistance activities are both effective and relevant to real family experiences. It's guided by a National Family Advisory Board comprised of primary caregivers of children who experience mental health and/or substance use challenges during their lifetime. In addition to their personal lived experience, these national experts represent an exemplary peer workforce that includes researchers, educators, providers and clinicians. The Peer Recovery Center of Excellence exists to enhance the field of peer recovery support services. The center serves as a resource for those doing the work of peer recovery support, helping the doers be bigger and better. They do this by offering training and technical assistance services to peers, organizations, and communities across the country. They offer help from those who have done this work, to those wanting to enhance or begin peer support services in their communities. Their efforts are guided by a peer-led steering committee, a group of experts and peers in the field from across the nation, to ensure peer voice is at the center of all they do.
Let's review a few key definitions that are central to the work of peer recovery and family peer specialists. For dependent children, a family member is typically a biological parent, a guardian, or a caregiver. As a child becomes an adult, this relationship may continue, or may expand to include a non-related family of choice. For family peer specialists, lived experience is defined as a family member or caregiver who supported a child experiencing behavioral health and/or substance use challenges, with navigating systems to reach desired outcomes.
Family peer specialists can articulate lessons from their own experience parenting a child, youth, or emerging adult, and they have specialized training to assist and empower families raising children who experience emotional, developmental, behavioral, substance use or mental health concerns. They may also partner with mental health and substance use systems to improve family outcomes. They strive to eliminate prejudice and discrimination. They may work in family-run organizations, managed care organizations, mental health clinics, hospitals, schools, police units, juvenile justice or any other role related to providing family support. Their titles vary from state to state, but the basic tenet of their role must include lived family experience.
Family peer support is the support a family peer specialist gives to another family, assisting them in navigating the systems necessary to achieve their goals. For peer recovery specialists, lived experience means having personal experience with mental health and/or substance use challenges that interfered with their quality of life at one time. They're trained to provide one-on-one strength-based support to peers in recovery. They work in a wide range of settings, such as community and mental health centers, behavioral health programs, substance use treatment facilities, peer-run organizations, community-based organizations, emergency rooms, courts, homeless shelters and outreach programs. Sometimes, they are referred to as peer support specialists.
Now, let's explore how the roles of family peer specialists and peer recovery specialists are similar and different.
Both family peer specialists and peer recovery specialists meet with the people they support, develop relationships, assist with navigating barriers and accessing resources, believe individuals and families drive their own plan, meet people where they are, and strive to ensure that the individuals and families they support reach their goals.
Family peer specialists focus on families and caregivers of children, of any age, who experience mental health and/or substance use challenges. Their goal is to provide compassion, understanding, and knowledge that will help families support their loved one, now and in the future. The focus of their support is resilience.
Peer recovery specialists support individuals who experience mental health and/or substance use challenges. The focus of their support is recovery.
While their focus is different, both family peer support specialists and peer recovery specialists use their personal lived experience to support others, providing compassion and valuable expertise that makes a difference in the lives of individuals and families.
Funding for the Peer Recovery Center and the National Family Support Centers of Excellence, and this initiative, was made possible by a Center of Excellence grant from the Substance Abuse and Mental Health Services Administration. The views expressed here do not necessarily reflect the official policies of the Department of Health and Human Services, or imply endorsement by the U.S. government.
All right.
Welcome to the Peer and Family Peer Support Connect.
So that link to that video will be shared when we share our slides after we wrap this up. And if you give me just a second to switch screens here, we'll switch gears and get to our next presenter.
So I think that what we saw was a great video. I apologize that the Wi-Fi was a little shaky there, but it will be attached when we send out our email, follow-up email, and you can watch it again. Also, this whole presentation and the slides will be sent to you and will be uploaded on, I think, both our websites. So you'll be able to access it a couple of ways. So when we look at the similarities and the difference in the roles, what's the same between family peers and peer recovery? Well, it's very easy. Whoops. I lost it. We both family peers and peer recovery specialists, we both meet with the people we support, but they're a little bit different. We both develop a relationship. That is so important. The relationship piece is deep. We assist in navigating around barriers and improve access to needed resources. We follow the individuals and families until they walk away. I often say to my staff, when I had staff that did family peer specialists, is they can walk away from you, but you can't walk away from them. There's no exit. We believe that family involvement improves the outcome of the individual, and we all know that. We know, especially, and I can only talk about families, and when my colleagues will talk about peer recovery, but with families, sometimes they're often resistant to get clinical support sometimes or take medication. And when you have a family peer specialist that's walking the walk beside them and saying, hey, you know, my child needed to talk to someone, I needed to talk to someone. It's a quicker entry into services, and it's a quicker and cheaper exit out of services too, in a more successful way. We believe that the individual and family drives their own plan. It's their plan, it is not our plan, and we all know that. And we want the individual family to feel successful. When a family succeeds, we succeed. And it's the greatest feeling. I don't know if you feel that way, but my goodness, that feels so good. Next slide. Michelle? You're on mute.
So looking at the differences in the roles, peer recovery support specialists, they primarily focus on the individual. Family peer specialists primarily focus on the family or caregiver of that individual. We're looking at the peer recovery support specialist is very much recovery focused, and the family peer specialist is resiliency focused.
But I want to jump in and just say, peer recovery specialists, even though they're recovery focused, and family peer specialists are resiliency focused, it doesn't mean that they do not have a belief of the other, meaning family peer specialists certainly believe that their families have to have some sort of recovery, as is peer recovery support specialists believe there is a sense of resiliency. Am I correct, Lori?
Absolutely. And two, you have to think about when families have co-occurring disorders, recovery, resiliency, all of that factors into the work as you're supporting families as peers. Next slide.
So the roots of the family peer support, how did it come? Well, I will be honest, it came from the recovery sector way back. But we also developed out of the system of cares. So our family involvement movement, the new roles for family members in the system operations, there were new roles emerging all the time in service provision. The wraparound movement, which was part of the system of care movement, that helped to really organize and plan and demonstrate that family driven really worked. And of course, there's local influences. We see every day more and more communities saying, how do we bring in more family peer specialists? Next slide. You want to take it, Lachelle?
Sure. The foundations of family peer support, just looking at that it was grounded in lived experience. Not most, all of the family peers support work. They have lived experience. You have a permanent relationship with a child who is seeking or who has sought care. They have experience navigating complex behavioral health systems, whether it's the school system as the child is younger, and then as they develop, if there are other concerns, they know how to work with, if the legal system gets involved, they know how to work with those systems, and they have had that experience of walking their child or their the child that they're responsible through that. They communicate to have active acceptance, really being able to recognize and manage their own bias, finding that fine line between this situation is really dear to my heart and I might be a little bit overboard, but finding a balance for that family so that you can actually communicate effectively with the service providers on behalf of the family. So that is, really managing your boundaries, utilizing your supervision if you feel like a case or a certain situation would cause you to be more biased to a specific subject. Really looking to committed to working on starting from a place of welcome for all of the parents. If you think about the first time, if you have a child or a loved one that was diagnosed, that first time that they talked about behavior problems, concerns, and symptoms, how scary that was, and how intimidated you may or may not have felt when you walked into a room with a whole bunch of professionals saying a whole bunch of language that was very foreign to you. So really working to build the families up, to give them the confidence to move forward, to speak up, and if they initially cannot use their voice, to help them find their voice in that process. Looking at based on strategic self-disclosure, again, that is finding that balance. When is it appropriate to disclose your personal information with a family, and to not overshadow them with your experiences, things like that. But when you're able to find that fine line that that it's going to help a family find a path of healing. Also, just being able to build your connections of partnership. When people feel that you're connected with other people, services that will help families, they feel comfortable. Like if you walk into a room and everybody knows you because you advocated for your child or you advocated for another family, and they know, that you're connected with those people, sometimes it will give family members ease. And I know a lot of people on this call have experienced that before. The last area is partnering with rather to deliver to parents. So the ability to stay in a peer relationship, support for support's sake rather than service's sake. So really building a relationship with the families we're working with. Next slide.
So what are the social returns on investment? Well, the practice that meets the needs of the family in obtaining positive outcomes reduces the idea of children and family members recidivism, that they become, have to use the system again and again and again. The mutual beneficial nature of parent-professional partnerships, the future of families where they do not need to rely so heavily on the formal systems. I think although a family peer specialist more and more is a formal system, we also have informal supports. And I think those are just as important. And increased connectedness to community resources and natural supports, and system transformation that is persistent, enduring, and lifelong. And I think this is really a very important piece. We also have to think in the family peer specialist arena, where is the point of entry? This gets kind of confusing. The point of entry is the child, even if it's an adult child, that is the child in need of services. But we as family peer specialists, because we have supported our own children, and I say we because I'm a mother of 3 who've needed, and I've needed support for them. We who support our children need our support. So although you may have the port of entry being the child of any age, it's the parent or the primary caregiver. It does not have to be a biological parent who gets the support to help walk the walk. Whereas the peer point of entry is different. You are the individual to the individual.
And the only other thing I wanted to mention in regards to the social returns on investment is the importance of natural supports, as Gail had mentioned. A lot of times when you're in a situation where it's an overwhelming or it's a crisis phase, sometimes families don't understand that their natural supports, what their natural supports are. So sometimes as that family peer specialist, it's your opportunity to show them what their natural supports are, or you really may have a family who have absolutely no natural supports, right? So how do you get into the community? How do you get into the community? Do you want to connect them to the food bank? Do you want to connect them to a church? Do you want to connect them to a single parents group or a family support group? But helping them understand that there is a community around them that can be natural supports to them, even if they don't see that as a possibility for them. So we can move to the next slide.
So what are the outcomes? Family peer support programs help parents who have children with special needs find and become reliable allies for each other. So no one makes me feel better than someone who is another parent who says, Gail, I've been there. And that is part of the family peer specialist piece. You know, who do you listen to when your child is sick and needs a doctor? It's the same line of thinking. I ask my friends and I rely on my advice of my good friends and my good neighbors to help me walk that walk sometimes. Parent-to-parent support programs are valued by parents and may improve the emotional functioning of parents who have children with disabilities and help them improve their coping skills. Parents display greater increase in hopefulness and were overwhelmingly satisfied with their experience. I know that when we give satisfaction surveys out to parents who've had family peer specialists, the amount of positive reviews and thoughts always are great. And everyone says, you know, we're so satisfied with this experience. It's helped in so many ways. There is an encouraging evidence of reducing child symptoms and improving child functioning as a secondary result of supporting the parent. And of course, evidence of some benefits to the parents and caregivers, including reduction of stress, improving mental health and well-being, perceived social supports, and increased engagement to services. And we're more and more learning about caregiver stress, and being a parent of a child who may need services or who has experienced substance use or mental health issues. You know, and I know, I am only as happy as my saddest child, and that is so true, and that I am always, that's about as stressed as I am. If my child is stressed, no matter who they are or how old they are, and I have a 38-year-old, a 35-year-old, a 25, it doesn't matter age, I am as stressed as they are. So caregiver well-being is very important too. Next slide.
Okay, thank you so much, Gail and Lachelle. Excuse me. We're going to talk about now the roots of peer recovery support. So some of the things that you'll see in peer recovery support is supportive learning, advocacy, inspiring hope, connection to resources, and leading. And how that shows up in terms of the models of peer recovery support roles. And that's on our next slide. Okay, thank you, Shannon. First, I just want to state that peers with lived experience delivering recovery support services are focused on various dimensions. And some, not all of these, are listed here in this chart. So starting with emotional support, we demonstrate empathy, caring, or concern to bolster self-esteem and confidence. And some of the examples are recovery checkups or recovery check-ins, peer-led support groups. Some of the assisted peer recovery support services are telephone recovery support, video recovery checkups, Zoom support groups. In terms of our informational support, we share knowledge and information and or provide life or vocational skills training. Some of the examples are discussing therapeutic court process, training for job readiness, offering wellness seminars or classes, training on self-advocacy and self-efficacy, offering parenting classes, and how the assistance shows up is telephone recovery support, the video recovery checkups, and again, Zoom support groups, which you'll see this continue down the entire column in terms of some of the examples. Instrumentally, we provide concrete assistance to help accomplish tasks, increase access and opportunities, and reduce barriers. So accessing community health and social services is one example, providing housing, childcare vouchers, providing public transportation passes. These are just some of the examples that you'll see instrumental implementation. And also we have affiliational, right? So we facilitate contacts with other people to promote learning of social and recreational skills. We create community, which is huge. We have a saying that human connection is protection. And so creating that community is really critical. And we foster a sense of belonging. Some of the examples are arranging outings and activities such as sober sports, alcohol and drug-free dances, movie nights, celebrations and rituals. And now we are in the space of also helping along the lines of harm reduction. So those are some of the ways in which the peer support roles are modeled. And so you may wonder in terms of what are the social returns? The humans we support are considered the experts of their own experience. So we rely heavily on their input. And peer recovery support occurs when people with shared lived experience connect with each other. There's a synergy that happens, much like I'm sure that happens within family peer support, because I also am in that role as well. The bond that results can create mutual empathetic experiences that foster growth and recovery. Peer recovery support work promotes connection and inspires hope. I cannot stress the importance of connection enough. And hope is one of the 10 guiding principles that we embrace and the vehicle that takes us on our recovery journey. In terms of other returns on the investment, it offers levels of acceptance, understanding, and validation that's not found in many other professional relationships. It helps people develop their own goals, create strategies for self-empowerment, and take concrete steps towards building self-determined lives, which is part of one of the key elements of the very definition of recovery. And so how about outcomes? So as a result of treating our peers as a resource versus an object, outcomes improve and include, but are not limited to, increased self-esteem and confidence, increased sense of control and ability to bring about changes in life, increased sense of hope and inspiration, increased treatment access and engagement. When you see folks that we stay in touch with through recovery checkups, if there's a need for a return to treatment or to become re-engaged, it's much more likely to occur as a result of those examples that we gave earlier. There's an increased rate of abstinence. There's an increased adherence to substance use disorder treatment, increased housing stability and primary care visits, It reduces the rates of use and return to use, and even the amount used as we enter into harm reduction spaces. It's reducing time in child welfare out of home care and quicker reunification of families, decrease substance use and depression, decrease criminal justice charges and incidents of probation or parole. Very often you'll hear somebody share that my sobriety date is, and I haven't been incarcerated since. And ironically, the dates are the same. And so there's also a decrease in hospitalization and emergency department admissions, which very often is a direct decrease in the cost to society. And so those are some of the wonderful outcomes that occur as a result. So now I'm going to turn it back over to my colleague, Shannon.
All right, thank you, Lori. Thank you, Lachelle, and thank you, Gail. So we're going to do one last polling question to kind of wrap us up and bring us back together. Again, that code is 68215115. It's up there at the top. And this is a word cloud. So thank you, Gail. Gail put that number in the chat. And the question is, what have you learned about the peer role during today's presentation? Share a few words or short phrases. And as folks participate and put them in, it'll pop up here on the slide. I'll give a few more minutes for folks to type in. And when we share slides in our follow-up email, we can also download this word cloud as an image so folks can have it. I always think they're pretty cool to share and post and just keep. I like that empowerment's in there. I think it's profound and definitely is a critical piece of the work that both peer roles serve.
I see both are important.
Mm-hmm.
Mindful, I see someone wrote, Karen wrote in the chat, mindful,
Oh, yeah.
acceptance of others, absolutely.
Mm-hmm.
Here's are the experts, absolutely.
And I
Ooh,
like that
see
someone said, I learned I cannot walk away from them, even if they walk away from me.
Mm.
I love that. Social connection.
Mm.
Inspiring to reduce harm. I love that.
That's good.
Qualifications for roles. Does that mean that you understood more about the individual roles? Anyone know? Yep, I see head shaking. Families are important. I like that.
Empathy, humility, social connection, conscious.
Human connection is protection. I like that, Caroline.
Good line.
Sensitive. Oh, yeah. I love word clouds. I really do.
Yeah, it's good.
Hope. You know, when Lori talked about hope, that really, I felt it, because that as a parent is sometimes that's all you need to get by, to get to the next day is hope.
Mm-hmm. And I think in a lot of clinical spaces, it's hard to talk about that because it doesn't seem quantifiable, but we know as humans, if we don't have that hope, you know, what's our next step then?
Mm-hmm.
All right, well, I'm going to go to the next slide, but feel free, Mentimeter will keep capturing these. If you want to keep entering them, throw them in the chat. We'll get it all and share it out in our follow-up slide.
So actually,
Okay,
at
these are
this
just a
point,
few additional resources. Oh, sorry, Gail, go for it.
no, go ahead. These are the additional resources, but I would love everybody to put on your camera and take off your mic if you want to have any questions. This is the time.
And I'll stop sharing so we can see one another.
Hi, everybody.
Angie has her hand up.
Oh, Angie. Yes, you're on mute.
Hi there. I was writing out a question to put in the chat. So I work primarily with parents of adult children being 30s, 40s, 50s. And what I'm hearing that feels like an obstacle is children, not adult children. And so could you clarify that or talk on that?
I certainly can.
Thank you.
As I said, I understand how that word children might get to the particular children. I have a 38-year-old. I have a 35-year-old. As a mother, they're still my children. So that's what we mean in terms of children. It doesn't, obviously NASTAC will support families who are supporting children from ages 0 to 100 and beyond. But that's the term we're using as what that family or who that individual who needs caregiver support is in terms of the idea. Now, obviously, sometimes as an individual becomes a adult, they may not pick, and you'll see the video too, they may select what they determine as their own family. And that way, you're right, that's not really children, but it's the idea of a family and who is the caregiver, and that's who we support. NASTAC supports the caregiver, be it biological or appointed. Does that help? Okay, thank you, Angie. Jessica?
Can you hear me okay? All right. So I work as a research assistant for Portland State University in their School of Social Work. We specialize in research that helps parents with children with special health care needs. We work on research that also combines such parents that are immigrants. And one section of our research also focuses on youth peer support. So I haven't heard much of that in today's meeting. I'm sure it's done. Do you have any thoughts or any programs you recommend or any ideas or maybe some new research areas that are coming around the bend or?
Well, I'll speak to that a little bit in terms of youth peer support. When we say peer support, it's not specific to any group, age, gender, sexual identity. It's all inclusive. And so even I'm a recovery coach professional. That's one of my certifications. And we had talked to them about perhaps doing a youth one, a geriatric one. They said it's applicable across the whole spectrum. And so specifically for young people, there's young people in recovery, right? YPR, which is a national recovery movement. But I know my daughter, who's also a woman in recovery, and I had 3 children at one time suffering with addiction. And she works as a youth peer navigator. That's her job. And one of the criteria was that she came through the system that she now assists within. And so our Department of Health it's under the, it's actually under the Allegheny Health and Human Services Department. But that
Right.
is her role. That's what she does. And
I know
so-
what we were finding is when because we're finding that it's better to combine both family support and peer support of similar ages at the same time. And so sometimes there'll be programs where the youth peer actually works with both the peer and the family at the
Yes.
same time, because both of those are crucial to reaching their goal of bettering themselves and finding the resources that they need and finding someone to talk to that can help them through it. So thank you so much. You guys were really
Yes,
helpful.
And Jessica, I can say that you at Portland State are in the epicenter of youth peer support with Janet Walker and Barbara Friesen and everybody. So they're real experts right there in your university. I'm sure you know them.
Yeah.
Also, just a little quick, maybe down a bunny trail. Youth peer support, you can look at Youth Move National if you'd like. We also just did a presentation where we found youth peer support often grow into different roles as they age and sometimes become adult peers, but sometimes they go on to do different things. So it's a very interesting piece. Any other questions, thoughts? Thomas?
I find my role as a peer support / recovery specialist is a little difficult because I work in a step clinic and I work with people that have psychosis and that are in the peer support. So my role is a little bit different from working, at night. I work with children that are autistic, but that I work in another job. But as during the day, I find that, for information for myself, that, I'm dealing with psychosis and recovery. I find that just not that much support and information on my, it's a new role that they had created, the step clinic. And then where's my support when I, do I take a little from here and there, where do I, where is that support? I'm taking down all your resources and stuff like that so that I know. So if anything else, is this a growing field or, as we go to psychosis, into that mental, ism field, is it growing there? Is it just something fairly new?
I'll speak to that briefly. I always refer back to SAMHSA, which stands for Substance Abuse Mental Health Service Administration. And I know they need some updating with their language. However, it does cover both mental health and substance use, right? And so I find that to be a great resource. And
What is it again? I'm deaf, so I hear names. What was it?
SAMHSA is a great resource for what you're asking.
Could you put that in the
Absolutely.
Thank you. I greatly appreciate that.
Sure.
And I'm from Community Health Link, if anyone was wondering where I was from.
Thanks, Thomas.
Thank you.
Thank you, Thomas. I see Carolyn.
Yeah, thank you for taking my question. I'm Carolyn Hatfield. I work for St. Augustine Youth Services in St. Augustine, Florida. And we are a youth mental health, a crisis mental health agency, and we serve children ages 6 to 24, and children and young and emerging adults who are suffering from significant behavioral health issues due to trauma, undiagnosed or late diagnosed developmental disabilities, that will manifest behaviorally or other mental health issues. So I'm the family peer support specialist there, and we have credentialing in the state of Florida. My experience with the training and with the testing, it's very heavily weighted towards recovery. There's very, very little to nothing for youth peer support specialists or family peer support specialists. And so what I'm looking for is I've been looking around the country at what other states and actually other countries have. And there is so much more available for training and for family peer support specialists like me. And I'm wondering, is there anybody around here who can direct me towards an organization who can help with, lobbying, at the state level to provide funds for training for family peer support specialists, for appropriate testing and credentialing, because
Are you you're looking for more information for mental health because you see a lot in substance use, but not enough in mental health? Did I hear that right?
No, we have training and credentialing and, a statewide peer support organization, but because it's come out of the recovery movement, the family peer support specialists were just kind of like tacked on. And so all of the training to do our credentialing, I've been doing this for a couple of years, and I'm looking back and I'm finding that my training was not adequate for what I do in my day-to-day job. I'm looking at the core competencies through the National Federation of Families, like, learning about, agency for persons with disabilities and IEPs and special education law and, all the different things that we have to, deal with. And so I'm trying to find out, how did other states, how did Arizona, how did Colorado get, the statewide, core competencies and training and credentialing available for their family partners, for their family support specialists, that recognizes the difference between family peer support specialists and recovery specialists. So I'm telling you right now, Florida doesn't.
Yeah, and I'm surprised you say that. The Federation of Families has several really strong affiliates in Florida, as the Family Cafe and Muriel Jones's organization in Miami. And I'm trying to think about, there are several different strong affiliates. And Dana just pulled it up if you want to see the Federation of Families affiliates.
Yes.
Now, the question that you've asked me is the reason why NASTAC, the National Family Support Technical Assistance Center, this is why they funded us. We're here to answer those questions and to help you.
Okay.
It's pretty complicated, but what I would love for you to do is to go on our website, and right up on the top of the website, there's a green button that says Request Technical Assistance. And if you fill out that form and ask us some questions, we'll give you personalized, individualized TA on your question. Does that make sense? Arizona's doing fabulous work. Right now, Michelle and I are working very closely with Colorado and Pennsylvania, all asking the same question you did and coming up with different ideas of how to expand the workforce. So we can talk about that for hours.
Great. I'll take you up on that. Thank you, Gail.
And you're welcome.
Can you put that information back up again, please?
Sure. There you go.
Okay.
There's one for NASTAC and there's one, Shannon, that's fabulous. One for peer and one for NASTAC. And I'm going to have a little caveat. In the next 3 weeks, we are really focused on our national conference. So if we're slow to respond, give us a little bit of grace, because we're all working very hard to get ready for Oklahoma City.
And that being said, I will do a nice plug about our pre-conference that we're doing, because we have a group out of Kentucky that really has found a way to find funding outside of System of Care grants. And how do you get your family peer support into out of mental health or substance use organizations and into a family run organization? So someone's going to put that link in there. We do have, you have to register for it. There is virtual, unless you're actually in Oklahoma. We're having this in Oklahoma City, but we're on November 2nd, we're going to do a pre-conference. And this team of people, they have found a really great way to, outside of a high fidelity wraparound team, to really financially support, just to give other states ideas about family support and how you can, you know, really get it more on the radars of individuals outside of working in a managed care organization.
Thank you.
So there's still a lot of work to be done because, you know, sometimes you can find some gaps in the system, right? We're always trying to figure out how do we improve access to care for families who really need the services that mostly everyone on this call does in terms of peer support.
This is such a rich conversation. Any more questions?
I have a quick question. I'm Latandria Davey, and I'm a family support partner out of West Memphis, Arkansas. And just listening to like the different conversations, I have to say Arkansas is one state that is really slow about getting things done. And I think when you was just mentioning the peer conference, I think that's something that I would be interested in attending, as far as trying to see how to get Arkansas on board with family support partner services and stuff like that. Because Arkansas is really, like I said, one of those states that's really slow about getting things together.
Mm-hmm. And if you look on I'm not sure who our affiliate for the National Federation of Families is in Arkansas. I should know this, but I don't. So I apologize. But if you look on the affiliate website, you might find some people to help in Arkansas move the workforce along. Also, just for clarification, our national—
Yeah, you're going in and out. We can't hardly hear you.
Our national conference there is a charge to attend our national conference. There's a fee to be in person, and there's a lesser fee to be virtually. However, the pre-conference, which is on the 2nd of November, is totally free, whether you're in person or if you attend virtually. So I encourage anyone to register.
And that link has been placed in the chat.
And I'm just getting a notice that we may not have an Arkansas affiliate.
Yeah, I
So—
don't think so. I know when I got my, when I went to do my certification, I was in contact with a lady named Leanne Sherman. And so she was kind of handling all of my stuff for me.
Okay. Well, thank you for that information.
You're welcome.
And Thomas?
I have one more question. My question is, we have just one facility here at Kiva that does the certification. They make the certification difficult, and I don't know why. I don't know why. It's peer-led. I don't feel that they're on the same board as being peer on peer, you know. I feel they make the course difficult. And it just, they're not friendly people. I've went through it, and I know so many people have gone through Kiva for the peer certification. I'm just wondering if anybody else in Massachusetts knows of a different agency or somewhere that they do it besides Kiva. No one?
If someone knows, please jump in.
Are you talking about certification for peer recovery coach?
No, for peer. Kelly, are you there?
Hi, Thomas. Yeah.
Can you
Go ahead.
Thank you. Peer what?
Certified peer specialist.
There's a place in Connecticut, I think, CCAR, that does peer recovery I don't know, different states call it different things, but we call them peer recovery coach or peer recovery specialist. They do training like that.
Would it be national? Would they accept it? Because I'm in Massachusetts.
Yeah, I'm in Washington State, and we use CCAR at Peer Kent where I work to train for the RCA Recovery Coach Academy. Is
Yep.
CCAR's coaching academy?
So is it, I mean, is it nationally recognized or is it just state? How does that work? You know, because because here they make it, it's just really difficult in Massachusetts. It's like up to a master's level. And I don't know why they make it so difficult when we're supposed to meet, when we meet the peers, maybe some might be at master level, but not all.
If I may, offers a recommendation, Thomas. If you could, I'll do like Gail did for her organization. If you want to reach out to the Peer Recovery Center of Excellence, perhaps we can help you with that question. Can you hear me, Thomas?
Yes.
Yes. If you want to reach out to the Peer Recovery Center of
Yes.
Excellence.
Could I give you a call right back? I'm in a meeting. Can I give you a call right back?
Oh.
Thank you.
Bless his heart.
I'm sorry.
Okay.
I'm sorry. I'm terrible.
Oh,
Sorry.
no worries. No worries, Thomas. Reach out to us at the Peer Recovery Center of Excellence and we'll help you navigate that question.
Yeah, because it just, it gets so frustrating and difficult when I know other people have taken the exam maybe 2 times, 3 times, and they don't make it. I'm not sure why how do I want to say it? I don't want it to be easy, but why it's worse than a college examination for for the boards and stuff. I just don't know why it's so difficult here in Massachusetts and versus other states.
Yeah, and a lot of the credentials accompany a history with them. And so very often we don't know the history and why things are the way they are. But I can assure you, Shannon Roberts, the program manager at the Peer Recovery Center of Excellence, has offered you her email to email her directly. We will help
her email that I can direct.
Yeah, I'm going to send it to you directly.
Thank you so much.
You're welcome, Thomas. Thank you.
I just want, you know what it is? I just want people to be, we're supposed to be at the level and everyone. And I just feel like the coaches or teachers that are doing the class at Kiever are just not on the same level as us, and they're a little bit above us. And it just, I'm studying to get a master's, degree, and I find the course to be very difficult, and it shouldn't have to be a struggle. It shouldn't have to be tricky or a struggle, and not just for myself, for a lot of us. Thank you.
And I think, Thomas, that's why we're here today. Both the Peer Recovery Center of Excellence and the National Family Support Technical Assistance Center, they're both centers of excellences. We're here to kind of clarify what kind of questions you can ask us and ask for technical assistance. So I'm really glad that you brought that up, Thomas. We are here. That's what we're getting paid for, to help you and to give you TA, technical assistance. We do bring webinars like this and different things. I know we have family connections and office hours, but really we want to help you individually. If you have a question, just ask. Go on our website.
Yeah, I just find, Gail, I just find that, and Laura, I just find, that it's a struggle. And like I said, I know a person that is taking the exam 3 times. 3 times, and the funny thing is they won't tell you what you did wrong.
Yeah.
See, I'm studying to become a clinician, so I have to write things in the 3rd person and a clinical based. I was already trained and stuff, so we have to put things in a simple term, and I'm finding that a very, very, very difficult, because we don't want to emphasize on, say, this individual has schizophrenia. We want to put it in layman's terms like this, and I'm finding it very, very difficult, that crossover. So,
I'm sure Lori and Shannon are going to be able to help you. So thank you, Thomas. Any other
Thank you.
questions? Any other thoughts or questions? Well, I think we have other questions. If we can pull up the slides so we can wrap things up, we can give you back some of your time. So what are our next steps? Between 3 and 5 business days, look for an email from us, and Michelle will send it out, I'm sure. It'll have a link to the recording of today's presentation. It'll have our slide. It'll also have an invitation for our upcoming events. We're going to just talk about our national conference for next month, I'm sure. Any additional resources we talked about today and ways that you can stay connected with us. And of course, when you fill out your survey today, after the end of this presentation, you will have a certificate of participation to go to. Next slide. Join us for November 3rd to 5th in Oklahoma City. I just can't wait for the National Federational Conference. It's my favorite time of year, and I've been to this conference since, I don't know, 1997. I know I'm aging myself, but it feels like just yesterday. Next slide. Here's our feedback. You can use the QR code, or you can click on the link that's there, or you could just exit out of Zoom and it'll take you there. NASTAC contact information, our principal investigator. I want to thank Linda for being our principal investigator and Michelle for helping me today. Next slide. And of course, we thank Adam Vieira, the new principal investigator and co-director of Peer Recovery Center of Excellence, and Lori Crone, the interim principal investigator and co-director. And of course, Shannon and Lori. Guys, thank you so much. You were great.
Thanks, guys.
I'm sorry, I have a question. Would you be able to put the survey link in the chat? I wasn't able to get it off the screen.
Oh, sure.
Thank you so much.
We will stay on.
And also,
go ahead.
yeah, and
Michelle.
as soon as you, I'm going to put the link in the chat to take the survey. Oh, okay, so we already have it in there. I will shoot it in there too, but as soon as you close out the survey, you have the option to take the survey once you log out.
Well, thank you, everyone, and have a really good week and month, and maybe I'll see some of you in Oklahoma City.
Thank you.
Thank you, Georgia.
Thank you very much.
Thank you, Thomas. Lori and Shannon, if you'd like to end, you can. I have to stay on just so everybody gets the survey certificate.
Sounds good. I'll see you in a few.
Shannon, are you the host?
I don't think so, but good double
Oh,
check.
okay. Just want to make sure.
I think I'm the host right now.
Okay.
Yeah, I'm the
Cool.
host. I'll stay on.
Perfect.
We'll
Thank you,
see you
Gail.
in quarter of.
Yep, sounds good.
As you exit out, you'll be taken to the survey.
I started the survey, Gail, so I'm just gonna finish it up and then I'll exit.
That's fine.
If I-
I'm here.
Yeah, if I'm the last one though.
Don't worry about it. Just
Okay.
go ahead.
Thank you. It was a
I
great
have
presentation.
no place to go.
I actually think I just lost the survey when I hit my
Oh.
microphone button.
Oh, no,
That's right.
well, it'll come back. When you leave here, you will get the survey. It will take you if you want to do it that way, or I can scroll again and get you the link if you want.
No, I'll see if I can finish here. If not, I'll end and thank you.
Oh, someone bringing it? What great people we have. I will shut this off around 3:20.
Gail, are you still there?
I am. What's up?
So I went to do the survey at the end and it wouldn't let me enter again because it recognized my information and said I already took the survey, but I didn't get to finish it. So
Oh, no.
the most important parts you probably want are the answers to the questions. So
Well, here's the thing. I hope this helped. I mean, do you have any advice for us in our next presentation, or how did things go?
no, I thought they went really well. A lot of stuff I knew because I've been a family peer support for a long time. But I like seeing things in the framework that you put it in. That was really important for me to see it that way. And I work in a in behavioral health home setting, and we have a peer services program here in Maine. So we have the intentional peer supports, we have youth peer supports, and we have the family peer supports. Then we have peer recovery, and it's like branching out so quickly. And, you know, there's a lot of wonderful opportunities here for the peer work and for families and individuals in our communities. So it was.
And you know what? I now know your name did look very familiar. I used to run UNH's Renew. I was one of the co-developers with Joanne Malloy, one of my dear friends. And we did Renew, and I think we worked with your main group, maybe before you or just as you were coming in. It was quite a while ago. But yeah.
I wasn't
the
around in
question-
1997. I probably came on, well, I was going through the problems with my own family at that time. And so I started doing this work professionally in 2000. So I've
Yeah,
been
so
around.
we were around there. I was in New Hampshire from well, I lived in New Hampshire for 20 years, and obviously the accent's from Massachusetts.
Yes.
But I'm now in North Carolina, and let's see, I worked in New England until 2006. And then I came down here. But yeah, oftentimes the big question or the stumper is, what's the difference between family and adult peer support? And why can't we use one for the other?
Exactly. Yeah. And we get that question a lot. So, so if you see my survey and you want me to complete it, you can shoot it over to me and I'll finish it for you.
Lori, no worries. And if you want a participation certificate, just email when you get Lachelle's email her back and ask her for one.
Okay. Thank you.
All right. Bye-bye.